All right, good morning. My name is Don Patchen with the Communications Department for Sarasota County Government. Thanks for the media for all showing up today for this update about COVID-19 in Sarasota County. Thank you also to our viewers that are watching us right now on Facebook Live. First of all, we'll have comments from County Administrator Jonathan Lewis, then Sarasota County Sheriff Tom Knight, and Sarasota County Health Officer Chuck Henry. After all three of their comments, then we'll open up for questions, and I'll discuss that process at that moment. First off, Sarasota County Administrator Jonathan Lewis.
I'd like to start by offering my thanks on behalf of Sarasota County Government. Thank you to our community for practicing social distancing at our parks and throughout our county. I'd like to thank our business community who have complied with the governor's orders. And thank you to all of our team members at the county who are working hard to ensure that our local government continues to operate. Lastly, I'd like to thank our first responders, both ours at the county as well as our medical professionals and those working retail. You're on the front line of this pandemic, and without your contributions, we would not make it. A brief update on some of the things going on at Sarasota County. Currently, we have 900 employees who are capable of e-working. They're out as our team members providing services to the county and our community from home. As you know, many of our team members have to continue to operate in the field. They're ensuring that critical infrastructure is still operating on behalf of the county. Some of those are our solid waste folks, making sure that the landfill and our curbside operations are still going. Our utilities employees, making sure our water and wastewater are treated and flowing appropriately. Our street lights and traffic signals are working. And our field services is making sure that our drainage, infrastructure, and others are properly being attended as we get closer to rainy season. Of course, our firefighters and paramedics are out there responding to calls every day, as they always do. Also, our SCAT bus operators and our SCAT facilities continue to operate to provide essential services for our community. This past week, we conducted a successful commission meeting, with part of it being done virtually. We will continue to use technology to provide transparent, open government meetings, as our board has committed to keeping the wheels of government and policy decisions turning. Our Emergency Operations Center still stands at a level 2 activation, staffed 7 days a week. We continue to work with our commercial and communicate daily with our local partners, including DOH, the municipalities, our constitutional officers, and of course the Sheriff's Office. We continue to receive PPE from the state and work with our local medical organizations to distribute these much-needed resources. We continue to evaluate the needs of the community on a daily basis. Those over 60 and those with underlying medical conditions are among the most vulnerable members of our community, and we continue to execute our plans to support those individuals. Lastly, I'd like to offer a few reminders as well, because we don't know how long this is going to last. Please continue to practice social distancing, especially at our parks that we have kept open to make sure people have outdoor opportunities. I continue to be amazed how our neighbors want to thank our employees as they continue to work in the field, providing essential and valuable services. We know that you want to thank them, and we appreciate it, but please continue to do it in a responsible manner. We know this is a holiday weekend for many members of our community, and many families will want to be together, but consider virtual gatherings and continue to avoid large groups. Remember, 10 or less, 6 feet apart. It's very important that all of us here in Sarasota County and throughout our state continue to follow the CDC guidelines and the directions put out by our governor and health professionals. As a community, we will continue to flatten the curve, and we will all practice good judgment that will eventually get us back to normal. Thank you for your efforts.
Well,
Well, good morning, everybody, and today, another great day in paradise, and I just want to kind of follow up with the county administrator about where we're at with your sheriff's office. And I think the last time I came and spoke to the group of you, it was people want to hear from their government, they want to hear from their sheriff about what's going on. Things have evolved since that time. The governor's put an executive order in for safer at home, put some restrictions on businesses and different occupations that are they essential or not? And so, of course, we talk a lot about what's going on in this county and what the county commission has implemented here. I think if you recall, the last time we had this discussion, we talked about boat launches. And one of the things that we talked about as a team and a policy group with the county staff was keeping our boat launches open and having people to have that opportunity to practice social distancing and practice the CDC guidelines and do the right things. I think you probably heard me say then, this is a smart community. We don't need to overregulate this community. This community is going to do what it needs to do. And sometimes it needs to be reminded of that, and the sheriff's office is here to do that. Fast forward a little bit, the governor puts out the executive order. We end up with a lot of information in it about businesses, who's essential, who is not essential. Very busy last Friday at this time, to say the least, is that my phone rang a lot. My employee's phone rang a lot about who's essential, who isn't essential. The sheriff's office put together a team of deputies to be led by a supervisor to interpret that. Our attorneys interpreted that executive order, the spirit of that executive order. And I'm here to tell you today is that it was a little chaotic over last weekend, of course, implementing something like that quickly, and the modifications that come with it for businesses and maybe some of the shock of the executive order. But things have gone very well, and as we move through this week, as many businesses that are in this county and the team that we put together, deputies, and some of the comments that we had last week was, we're going to be ambassadors, we're going to go out and educate people. It's worked. We're really happy of where we're at. We're seeing compliance of the businesses and who is essential, who is not essential. And you have to remember, part of our role is to educate them. Most of these businesses don't have attorneys. They interpret it for what it is. It's a 30-plus page order with 15 pages of exceptions and essentials. And so our job is not to go out there and just start enforcing it. Our job was to go out there and make people understand it. For those who aren't understanding it and not complying simply because of not negligence, but just not understanding it. So it's worked very well. We have a team of deputies going out and making those contacts. They're educating people, and I have to say, the businesses that were open have closed predominantly because of their lack of understanding of the executive order. They understand it. There are a couple businesses that we will have to continue to deal with, to be quite honest, that we will, and we're communicating with their attorneys on that, of how we're going to handle that. But again, what we look at here and what we talk about as a team with the county administration and the health department is what's best for Sarasota County. And we get asked a lot, and I get asked a lot as sheriff about some communities doing this and doing that. Are you going to do that? And I always tell the people who call me is that I can't answer for what their decisions are, their culture, their community, who they are. What I can talk about is what I know in this community and the input from the sheriff's office. And right now, my recommendation on our calls is we don't need any more regulations in Sarasota County. We don't need an overlay on the governor's executive order. We're getting great compliance. It's not perfect. But even if you put an overlay on it, you're not going to get compliance either. It's like speeding. Somebody's always going to speed, right? And so we just continue to stop them and educate them. And we're going to continue to do that. I don't believe in smothering this community. Again, we're on an Easter weekend. This is a great weekend. The weather's going to be nice. Go boating. Get out of your house. Follow the CDC guidelines. Follow social distancing. Our marine units are on the water. We get an opportunity to stop and talk to people, make sure they're compliant with it, continue to reinforce that. And we have to remember, the bulk of the people out there have no contact with law enforcement ever. And I don't want them to have that contact in a negative manner now, because they're going to do what we ask them to do. We're going to continue to educate them. So we're in a great shape here in Sarasota County. I think all jokingly, talking to my staff yesterday, looking at all the thousands and thousands of businesses in Sarasota County that are coming under the governor's executive order, I think the number was 2, which would be about 0.00011 of the amount of businesses that we have found not in compliance. And the other ones that we found in compliance, or who weren't in compliance, we educated them and they did the right thing. They either closed their doors or found a way to comply with the executive order that the governor's put out. And I think it's important for us to know is that the governor has all the tools in the toolbox. If he wanted more stringent guidelines in the executive order, he would have put them in there. But it doesn't preclude us from having that discussion as a team and doing something more if we believe it needs to be done without overreacting. And I can say as a sheriff right now, my discussion with the team is nothing more needs to be done. The county commission had a great meeting the other day. They do call and talk to different team members that are involved with some of these things that we ask them for their help. And I can't see anything else being done in this community right now other than people continue to do what they're doing, practice social distancing. It's becoming a conditioned behavior for these individuals now, and that we don't need to smother our community. We live in a great area. Go to the parks, take a walk, go out in the boat, practice social distancing. If you're out of the boat on a sandbar, do the right things. I was out in the sheriff's boats last week. I saw compliance. Couple groups we did pull up to, they separate just like we would anywhere else in the community. So we're happy where we're at. I am, at least from an enforcement standpoint, and what the sheriff's office role is here. And so we're in really good shape now. We're going to get through this. So with that said, I'm going to give it to Chuck Henry, and Chuck give you an update on what's more important than compliance is our health of our community.
Well, good morning to everyone. It's a pleasure to be here with you this morning, and I just want to start out by acknowledging that since the end of February, my public health staff and our county health and human services staff have been working tirelessly to develop and implement community protective measures aimed at slowing the spread of COVID-19 and flattening the virus curve for our community. There's many important measures we've taken so far, and often public health works in the background, and they say if we're doing our job right, no one really even knows we're there. But this situation is a little different, so I thought it was important that I share with you some of the key actions we've taken thus far to make sure the community is aware of what's going on. Probably on the top of that list is establishing our contact investigation teams. So these are teams that, when cases are identified, reach out to them. We have epidemiologists on this team. We have nursing staff on these teams, and they identify not only the cases, but everybody that may have been in contact with those cases during the infectious period, and then we give them advice on quarantine and isolation as the primary method of protecting our community. We also established early on elder care response teams. Initially, we just went out to all of our elder care facilities to make sure they were aware of CDC guidelines and best practices, and that we were aware if they had equipment shortages. As that's progressed now, the Agency for Healthcare Administration, who regulates most of those facilities, has joined us, and we do joint visits to those facilities whenever there's a significant illness. We work with their staffs to make sure that they have awareness and are practicing the most current infection control procedures, and also performing isolation in good ways. And then their personal protective equipment becomes critical for those facilities. So we try to work with our Emergency Operations Center to make sure that all those facilities that are dealing with ill individuals, especially our most vulnerable population, have the personal protective equipment they need to do the very best job. We established a COVID-19 information line at the health department, specifically to provide information to residents on their concerns about infection, or how to get testing if they need it, and provide guidance. That phone continues to receive about 200 calls a day, so it's an important part of our information strategy. And we were able to partner with Sarasota Memorial Hospital and Sarasota County government to provide drive-through testing over the last 2 weeks. This is our 13th day of testing. Tomorrow will be the 14th, and then we'll take a pause and reassess where things are going. But by the end, we will have tested about 1,000 individuals through that process. And we're going to watch closely to see what other testing services come online in our community, and make sure that testing is available throughout the community. We continue to follow up with our elder care facilities out of our Emergency Operations Center here. We have an ESF8 team that makes contact with all 117 of our elder care facilities every day just to check on their status, to find out if they have any current residents that are ill, to find out if they're short of supplies. And it's just a really important piece of our strategy to try to protect our elder population. Other work that we do jointly with the EOC is developing plans for the community. Examples of those are housing plans for healthcare workers and first responders, or individuals that aren't able to isolate or quarantine safely in their home because of other residents there. We've convened meetings with all of the executive leadership and planning staffs from our area hospitals to look at their surge plans and to review those, and for us to get a better idea at the county level on how we can support that surge activity that's expected in the hospitals in the next few weeks from an emergency operations perspective, and also to tie together the resources across the community. We continue to outreach to agencies that provide services to our vulnerable population, including the homeless, to ensure that they're practicing social distancing, to provide materials and education so that we can continue to provide services to that population, but do so in a safe manner. We developed a countywide feeding plan focused on vulnerable populations that may be impacted by COVID-19, which would include homeless individuals, with the goal of making sure that just because someone is quarantined or isolated, that they're not cut off from food availability. So that plan is already being implemented where needed. Our environmental health teams have been working with the Salvation Army to ensure that they have the best and latest information on infection control practices for sheltering. And the group sheltering can be a difficult thing to do in this time, but we work with them. We're available to them for consultation, and they've been a fabulous partner. We also work with our local municipalities on homeless-related issues. And towards that end, there was a homeless shelter plan developed specifically to allow us to quarantine or isolate an individual that doesn't have a safe place to do that, working with many of our local hotels, and that plan has already been implemented. We also have a hygiene and sanitation plan that's been developed. I think it's been implemented a little bit in the city of Northport, but thus far hasn't been implemented in other cities. Again, we're watching that closely. Both the cities and the county have kept many of the park facilities open and available to that population, and so we're monitoring to determine, is there a public health need for more sanitation and hand wash capability, which we can roll out as the plan provides. We've been participating in a weekly COVID-19 coordination for homeless individuals and families work group. That work group is attended by almost all the municipalities, both leadership and planners from the cities, as well as county staff, also our local foundations. It's led by the Suncoast Partnership to Prevent Homelessness, and they've been a tremendous partner in this as well. That meeting's been going on for several weeks, and they gather twice a week and talk about the issues for that part of our vulnerable population to ensure that we're taking the measures necessary to protect them. Health and Human Services has also implemented a weekly phone call with our foundations to help us understand what they're hearing, where they may be able to help, and to make sure they have the most up-to-date information on what's happening in our community so that they can get plugged in and help out wherever possible. That's a lot to say, but we still have a lot of work to do. We have not reached our peak illness or peak hospitalization date in this community yet. Some of the models, and there's many out there, and I think you've heard me describe them as similar to our hurricane spaghetti models, so they're just that, they're models for planning. Some of the models have us peaking hospitalization on April the 21st, others a little bit later, so we continue to watch data every day. It's encouraging to me to see that statewide the number of new cases reported daily has begun to plateau, and so we're hopeful that it will drop. And even here in Sarasota County, the number of new cases reported daily seems to be slowing down in terms of the exponential growth. So that is encouraging. As we get closer to that peak hospitalization day, I want to re-emphasize what you've already heard from the other speakers today, and that is the importance of social distancing. It truly is the best public health tool we have in our hands that all of us can do to help our community be safer and stay well. Our community has been tremendous at following the recommendations and guidance from the governor, from Mr. Lewis, from the sheriff, and I think, as they already noted, we have a very responsible community, and I thank you for that, because it makes a huge difference for us as a community. I ask as we move into this Easter weekend that we all please continue to take this responsibility seriously as individuals. Protect your families, protect those around you, and keep practicing social distancing throughout the weekend. That's the way we'll save the most lives and prevent the most illness. Thank you very much for the opportunity to make these comments.
Thank you. Now we'll move into questions. And so what we'd like to do to help folks that are listening to us on our live stream is please identify who your question's for, and we're going to have it repeated on mic so the people streaming can hear it directly. And then, but when you ask your question, ask for it, who it's for, so they can start moving their way up to the podium. So we'll take a first question. Right there.
Help. Where does the county stand on testing kits? And the other thing I'd like to know is, where do you stand on the malaria drug, and what are you telling people about that?
Question is for DOH, asking where we stand on testing kits and the malaria drug.
So in terms of testing kits, supplies are beginning to move into our community in terms of patient sampling kits, and the lab capability to process those samples continues to improve. As I noted in my remarks, we've been conducting a drive-through for the last 14 days. We started out with a goal of hoping for 50 a day, and that's been up to 70 or 90 a day that we've been able to push through that. We continue to have ample access to supplies for testing, and we're encouraged to see more of those supplies coming into the community broadly, which is why we're taking a pause on the drive-through to see if there's a more effective way to reach specific communities to ensure that testing is available to everyone. In terms of the malaria drug question, I really don't have a comment on that as your local public health official. Those are clinical trial decisions, and I would encourage you to reach out to our hospitals. Many of them are participating in those clinical trials.
Next.
Who's your question? Question is for the sheriff regarding, is there a strain regarding on our emergency personnel?
We've been fortunate. I think one of the questions that comes up to me a lot is our jail. And we had our jail staff jump on the jail real quick, so we have certain areas isolated. We have no issues in our jail. You're hearing about other jails starting to have problems now, so knock on wood, we feel comfortable where we're at with our jail. From the employee standpoint, our health and safety office, our nurses in-house track all them. We do have people who have not tested positive. We haven't had one tested yet, but we do right now have, I believe, 7 people at home in 14-day quarantine. We've had people who travel, who come back from Louisiana, that we treat them exactly the way the CDC guidelines say to treat them, and we treat them the way Chuck Henry gives us information to treat them. So is it putting a strain on us right now? Absolutely not. We have resources, and we have extra resources now. We have our deputies who be normally in the schools are here with us now. We have ample resources. Our arrests are down, which is a good signal for this county that people are complying with this order and doing the right thing. We have a team out making sure there's compliance with the governor's executive order. We feel no strain on our resources right now. We're business as usual.
Next question.
Sure. Questions for DOH regarding homeless outreach, what we're currently doing. There's some things going on with the city and what they're doing, and what are our plans for the future.
So a lot of those I covered in my comments on what we were currently doing. So in terms of right now, today and yesterday, I have environmental health teams that normally are engaged in food service safety and general sanitation and hygiene, reaching out to those organizations in our community that are service providers to our homeless community to ensure that we understand where they're at with supplies to stay safe themselves, to make sure they have the latest recommendations and guidance on social distancing so that we can protect not only them but our vulnerable population, and to ensure that we have the correct plans in place. Those are difficult populations to work with. So it's very important for us to continue to work with them. The city of Sarasota has been a great partner, as have all of our cities, and have been engaged with us in regular daily conversations. Those conversations involve a lot of ideas that get tossed up to think about, and we have to think about what is the public health implication, what is the best decision for the population we're trying to serve, and we continue to work through those issues with our partners in great ways.
I have another question for you. This is a question from one of our media partners monitoring on Facebook. We're wondering if Sarasota has any outreach groups for COVID-19 testing and the African American Hispanic community. And also, there's a lot of the transportation, healthcare access, and misinformation, and there seems to be some barriers for these groups. What are we doing as a county working on those efforts to make sure they have access to testing and resources?
So this is an evolving process, and as has already been stated, we've had the drive-through opportunity for the last 2 weeks, and one of the concerns about continuing that, because we have limited staff and resources, is are we reaching everyone we need to reach? So we're reevaluating who's had access, who hasn't had access through the current methods. I will say that our federally qualified health centers, and there's 2 in our county, are open and available for individuals that are uninsured or underinsured, and they're doing some testing themselves. So those are access points within our community, some of those right in some of our most vulnerable communities. In addition to that, we're talking to various community leaders and different groups about opportunities to do pop-up testing events in communities to ensure that we reach all of the populations that may need testing.
We have another question that came in from TSP. It's a two-parter, one for both Department of Health and the Sheriff. The city is talking about some kind of tent city and how that would be organized and how would that be regulated. Maybe Sheriff, you can take that. And then Mr. Henry regarding about having that many people together.
I'll take my part on that question first. That's been an idea that's been looked at and proposed. I haven't seen an actual formal plan at this point. It's been a discussion. From a public health perspective, I certainly have concerns about gathering people together in a large encampment. Not only is that a concern for our current situation with COVID-19, we can certainly place shelters a certain distance apart, but we have the same issues controlling individuals that we have where they're currently at. And so we're exploring, are there better ways to do that than an encampment that would provide more protection for against COVID-19 for that population. You know, at the same time, anytime you put an encampment together, there's a whole litany of public health concerns that come along with that, including waste disposal, water, food, etc. And so it would be a huge undertaking, and from my perspective, the same oversight has to happen both with a camp like that or in the current situation. So I, thus far, based on what I've heard, have not been in favor of moving people to a camp. I'm not sure if we could even do that in a mandatory way, so then we'd have some people in one place and others still in another, and the same problems continuing in the community.
I think that's a great question because we serve everybody, including our homeless population, our chronic homeless, and we rely on the health department for health issues. One thing that we have to remember is people still have their constitutional rights, and that there's laws governing how we treat people, whether they're homeless or whether our intentions are pure or we're trying to do the right things. So there's no legal basis for being able to move people from one location to another using law enforcement to do that. There certainly is a huge amount of civil litigation that will come up over that. And so the other side of that is I get asked a lot about tent cities and things for inmates, and I think people forget is that we live in a hurricane zone, and tents don't do real well during natural disasters, nor do they do well in the summertime during rain. And so the tent city is something I perceive as a kind of an emergency Band-Aid, something that's not even optional because of the health risks that come with it, the social distancing, all the things that Mr. Henry talked about. And so we're at a crisis point, or the city's at a crisis point inside the city where they have this problem. And I think this is a really good time when you have emergencies, you have situations like this, that this is a really good time to reflect back on policy decisions, and that we're hearing a lot from the city manager about sheltering the unsheltered. And that we have to go back, and I'll give you a little history here. A lot of young people that I've been with now get to know is that I've been sheriff since 2009, so I'm able to become involved in a lot of the dialogues or hear a lot of the dialogues of operations. And so I think it's important that when we're talking about sheltering the unsheltered now, and we're talking about some type of a quick solution, is that we have to reflect back, or specifically the City of Sarasota government, Mr. Barwin, has got to reflect back about what was done in 2013 and 2014, and if that would have come to fruition, the shelter would be sheltering those unsheltered right now, about a shelter that the City of Sarasota did not want the county to do. And so for those of you who are new to our community, we'll go back to 2013 when the Sheriff's Office was involved with the county government, and Dr. Robert Marbot, who is now the national selection for national homeless, was selected and hired by the county government in conjunction with the city government to put together a plan, a countywide plan on homelessness. And I won't bore you with all those dialogues, you can go back and research that, but Dr. Marbot is the expert on it, and he had a lot of solutions and a lot of opportunities for chronic homelessness. And as it evolved over the next couple years, up until I believe it was September, I got my notes, I keep all my notes here, September of 2 years later, where the city government of Sarasota said that they did not want a shelter. They did not want anything from the county, and the county is going to provide that to them. And I know that because the Sheriff's Office is going to operate it. And the whole idea of that shelter was for the same individuals that the city wants to put into tents now. And so I would say every crisis brings opportunity. And so that was a missed opportunity to where the people who are not being sheltered now, that the city has concerns about being sheltered, rightfully so. But I think as policymakers, like I do all the time, are my decisions right and did they work? And I think this is a great time for the City of Sarasota residents to ask his government, ask the city manager, was your decision right to not take the county government and the sheriff's offer up to build and utilize a shelter to shelter those who are unsheltered, to keep them safe and secure, to keep them out of the conditions like you're in now, so we don't run into an emergency and start talking about things that are not doable, that are not healthy, as such as tents. And I know I was with my homeless outreach team 2 weeks ago, and I know what we're doing, and I see the impact that my team's having, and I can assure the City of Sarasota the people that my homeless outreach team are giving services to are not part of their not part of what they're seeing in their city, because the people we're touching, the people we're using, the services that we're using between the Salvation Army and other services that we have, there are people going into shelters for our shifts programs, our Arbor Village and different things, is that we follow up with them and make sure they're not out on the streets and that they're there. So I would say that right now is that was a missed opportunity, has now become a crisis inside the City of Sarasota, and a tent isn't going to solve that crisis. A tent could compound a viral issue right now, and to think that way. But when you think on an emergency basis and you think on emotion, you think irrationally. I think a rational thought process here now is this is a great opportunity to take a bad situation and go back to the table as governments and protect the citizens who need the most protection from governments. So what we serve for is to protect everybody, and that policy decision back then the right policy decision? Did the plan that you put into place work? Doesn't seem like it is, or you wouldn't be asking for tents. And so this is a good time to maybe come back as policy groups and governmental bodies and serve the public that need the service the most, is the homeless. And get through this and make those rational policy decisions in the future. So would I ever condone the operational use of tents? Absolutely not. You do not have enough law enforcement resources to police it. You can't force people into a tent, because that would require forcibly bringing them there, which would be violating the Pottinger Rule and everything else, as we learned back when we were talking about that with Dr. Maubart, and that we need to let the experts dictate to us our policy decisions. We had that expert here, and that government decided that they did not want to use his information. So my message is not looking at something that was missed, looking at, was that decision right? Does it give you an opportunity to do something in the future better? Does it give an opportunity to open up dialogue again with the county government about what's good for this entire county, including Venice, Northport, and the unincorporated areas, to work as a team for that vulnerable population of homelessness, and to use this crisis as an opportunity to reflect back about, was that the right decision? My answer, if I was living in the city of Sarasota and I was a resident there, would be no. I haven't seen a change, and I don't want people in tents, and I want you to look and work with the county government on a larger solution and bring an expert back to help with that.
For DOH, is there anything planned to bring to testing for antibodies, to bring that to the community?
So at this point, we're still in a case discovery and contact tracing mode, and so for that process, the swabs are the best tool to use, because they measure shedding of the virus, so it tells us who's actively infected that could infect others. The antibody tests will be useful as we move through this in the future, because it can give us an idea of who has been infected and has recovered. And the reason we don't use that now is because it takes between at minimum 4 days, but maybe as long as 8 days after infection before antibodies start showing up. And by then, the person has passed their most infected period in terms of shedding viruses. So from a public health perspective, we're still really focused on identifying individuals currently shedding virus.
Does anybody have any additional questions? And we'll wrap it up. Okay. Thanks to everybody for attending, especially the media for attending today's press conference. And thank you also for everybody watching on Facebook Live. We do realize we may have some technical issues with the stream today, so I want to guarantee anybody still watching, we'll post that entire press conference. We'll repost it in its entirety very shortly. For the latest on county's COVID-19 operations, always visit scgov.net and click on the COVID-19 button on the center of the page. You'll always see the most updated information related to the county government. And also, you can always get direct information from our county contact center at 861-5000, Monday through Friday, 8 to 5. Thank you very much for attending. Thank you.